Hi everyone, and welcome Mary, who has kindly agreed to tell us about her volunteer story and how volunteering has led on to her career. So Mary, it's lovely to see you. I wonder if you could start by telling us a little bit about what brought you to volunteering with the Trust in the first place.
Um, okay. Thank you very much, Joe. Nice meeting you. So, what brought me to volunteering actually? At that time, I had started studying clinical and community psychology, and my modules were in depth, talking about mental health, people, presenting distress, psychological um, distress, and mental health issues, mental health disorders. And I thought that, it would be a good idea to go and have an experience meeting with people who are, trying to experience, such mental health issues. And when I searched C and I saw exactly what I wanted to get. And then I said, okay, let me give it a go. And that's how I started volunteering at C and I.
Brilliant, thank you, Mary. And what volunteer roles did you undertake at the Trust, Mary?
I started with the trolley, taking to the trolley on acute wards. Oh, it was so, interesting. And it was such an experience because I had never had such an experience working, in a mental health, And I also tried to help the OT on two elderly wards. Ones who had mental health issues, and they had also like dementia, and I could really try to you know see how the theory applies in the practical sense of how people were presenting and what was helping them to keep safe at the same time, how to engage in activities which were really helping them to with their memory, especially with those ones who had like dementia. And when I was also taking the trolley around, so I had an opportunity to listening to the stories of the patients who were really struggling, with mental health. And then I found out that, they were telling me, their experiences, how their diagnoses were. And what I also observed that they had the same diagnosis, but they were presenting in a different way. So I figured out that despite of the fact that you have that same diagnosis, but people are individuals, and that was really very helpful in my studies.
Yeah, that's really great to hear, Mary. So volunteering kind of brought that theory to life a little bit for you. Really great, thank you. I wonder if you could share with us what you think you've gained through volunteering.
Apparently, it's a lot because through volunteering, then I thought about, applying to have a job, as a support worker. So applied a fantastic job to start, a project with volunteering. So I was one of the person to lead an innovative debrief project. That was such an amazing experience because I had to develop leadership skills, attended, different courses like workshops. And also that really gave me a clear picture of how things really operate, in an NHS. And I also realized how important the volunteering sector really helps the organization because normally volunteers really give a lot to the organization. And I also realized that without these volunteers, sometimes we do not know exactly how we really perform, because normally, for example, a patient is not going to feel free to tell me or tell another staff exactly how they feel about things. But when I was leading this project, the debrief project, apparently, we were gathering some, information through a narrative, whereby patients could tell us, how they felt when they were being restrained, and what were the triggers before being restrained, and then after the trigger, and how the restraint was, carried out. All this kind of, narration tried really to give a clear picture, of how the services are being, run, and how we can improve the services. And
yeah, the volunteers are able to bring that kind of independent side, aren't they, which I think is really valuable in a trust. And yeah, you worked with me on the Restraint Debrief project, and it was great having a volunteer that had that insight to volunteering, and then the learning you'd had in your healthcare assistant role to bring to that role, I think made it really successful, which was great. So you've told us a little about your healthcare assistant role that you've been doing on the wards, and obviously you did your project management role, which was fantastic. And you've now been successful in going on to an assistant practitioner role, which is really, really great. I wonder, do you feel that volunteering was a useful experience in your career journey? Has it helped shaped where you want to go, or given you skills, and kind of knowledge that you think you wouldn't have achieved if you hadn't volunteered?
Oh, definitely, definitely. For example, with leading the innovative project, the debrief, I had not thought of, taking on a master's, program, first hours, I had after, finishing that project. Was like, thinking, okay, if I go on this course, I can do a better job, in the same trust. And I also thought about the leadership skills which I developed actually at that level. If I had not done, if I had not volunteered, I wouldn't have, probably got that job, because at least I knew it gave me, ideas about what is happening. How do you work with other volunteers? What kind of roles, and how can you help, how can you help to shape this if you are volunteering ABCD? And actually that really gave me an idea. And I could see that yes, volunteering is really led me to see exactly what I wanted to do as it regards to my career path, because for example, I wanted to be a clinical psychologist, and I still want to be a clinical psychologist. But at the same time, when I was doing volunteering, then I thought about plan B and C, and I said, okay, there are other opportunities. Even if I don't become a clinical psychologist, I can do this. For example, the role I've just got, I applied to become an assistant practitioner in the recovery and rehabilitation. And when I look back, I can see that, okay, volunteering was really good because it is shaping my career path. This is exactly what I value, helping people who are struggling, with mental health, where I can make a difference. And this is exactly the route, you know, just like focused on. So I think I would probably struggle a lot, to be where I am if I had not volunteered, because my career path is very, very competitive. and
Yeah,
you need to have that experience. And for me, I feel like, a volunteering was the best, because exactly it put me, in that place where I wanted to be, and I
yeah,
didn't think about it. But when I started volunteering, I was so happy about it, because the values of
and it gives
volunteering,
you a
yeah, yeah, the values of volunteering and what my values are, and in the career path, and my education, they resonate. They're all the same. So I'm
yeah.
happy, and I'm to have such an opportunity. And I do believe, in future, so I'll still volunteer. I'll still do some, volunteering with C&I.
That's fantastic to hear, Mary. And it sounds like volunteering really solidified kind of your idea of what you wanted to do and really confirmed that was the right career path for you, which is fantastic. Mary,
Yeah.
thank you so much for your time, and thank you again for volunteering. And it's so fantastic to see you go on and achieving the amazing things you are, and we wish you all the best with that. So thank you
Thank
very
you
much.
so much. Thank you so much for the volunteering opportunity.
Pleasure.